Well, good afternoon, everyone, and welcome to Samaritans Purse International Health Forum. We're just so excited for you all to join us today from wherever you are in the world. Our objective here at the forum is that you just learn more about medicine and the medical sector at Samaritans Purse, all in the name of Christ. And today I'm especially excited about this presentation. Before we get started, I just want to remind you all that to your right of your screen, you'll see a chat box. And at the end, we'll have time for Q&A, and we'd love for you to participate in that. Also, if you could, before we get started, if you could just sign in with your name and maybe where you're listening from, that would be great, so everybody would just recognize the listening audience. And with that, I'm going to start off in a word of prayer. Dear Heavenly Father, we just thank you so much for this forum, this technology that's available to us to learn more about medicine for the sake of the gospel. And I just pray you'd speak through Barry today. I thank you, Lord, that he has just availed himself and prepared for this presentation. And I just pray that Samaritan's Purse would have a greater impact in human trafficking around the world. Lord, we thank you, and we pray this in Jesus' name. Amen. So today, very excited to have Barry Jessen. I just want to point out before I introduce him, in his part of the world in Cambodia, it's 12 a.m. So be especially appreciative to Barry for his hard work and staying up late for us. But Barry serves as Samaritan's Purse Country Director in Cambodia. And today he's going to be presenting medical professionals identifying and assisting victims of trafficking. And Barry has quite an extensive array and a background of experience. He was educated in environmental management, and he has a diverse background in coal mining and truck driving. He brings a broad range of skills and experience to human protection issues. This experience has been really a solid platform for him for over 13 years of living and working in Asia and addressing this issue, human trafficking. And though passion really plays a significant role in the fight against human trafficking, Barry really believes that there are four pillars of successful programming, and those are data-driven programming, empowerment, awareness, and collaboration. Barry passionately believes that the fight against human trafficking brings us to where the people are hurting and when they are hurting. This is where we as Christians need to be, being the one who crosses the road to bring help and love. And so, again, I'm so excited for us to bring this presentation to you today. And Barry, without further ado, I'll turn it over to you, sir.
G'day. G'day, my name is Barry Jessen, and it's my honor to be here today. I'm really excited to be able to share with you. As Dr. Lance identified, protection and particularly anti-trafficking is a long-held passion of mine. Why? Psalm 82:3 tells us that we must defend the weak, the fatherless. We must uphold the poor and the oppressed. And I'm one of the the minority in the world who really has never been poor and oppressed. And I feel it's a great honor and a great privilege to serve God in anti-trafficking. I've been working to identify and assist victims of trafficking for 13 years now, in a range of activities, including investigation and awareness, recovery and reintegration, and broad-scale community prevention programming. This year, Samaritans Purse Cambodia will directly communicate the safe migration and anti-trafficking messaging to more than 80,000 people in villages across the Cambodia-Thailand border. Program staff will assist more than 20,000 people with direct and relevant input to reduce their vulnerability to exploitation and trafficking, such as livelihood support, access to reliable water, assistance with documentation and establishing savings groups. We anticipate that here in Cambodia again this year, we will identify some 2,000 victims of trafficking and supply immediate support to allow them to return to the safety of their home village and to link to any available partners for further assistance. So that's a little bit about who I am. I could talk all day about protection, and hopefully one day we'll be able to sit down together and do that. But let's also today be honest about who I'm not. I am not a medical professional. So I don't know your language. I don't share your experiences. I cannot read your writing, and your jokes are often quite weird. I am related to a doctor and a paramedic. I have been on the receiving end of the care of some of the best ER nurses and doctors in the world in various medical facilities. But that's as close as I get to being one of you. So I may well use terms or medical terms that are partially correct or totally incorrect. Please don't be distracted or offended by that. I don't pretend I am not a medical professional. But this leads me to my first point today. So if we could go to the next slide. Unlike the art of practicing medicine, you don't have to be overly bright to be an active and effective influence for change in anti-trafficking. I spend most of my life now training people with less than a Year 6 education to identify, assess, and respond to human trafficking, many of whom are illiterate. So you can imagine how excited I am at the idea of being part of equipping and unleashing a group of motivated and educated professionals who are, by the fact that you are here, you define yourself as wanting to do more than just show up for work. The fact that you're here on this podcast here means that you're looking for a way to serve God through serving people by showing His tangible love, and that is super exciting. Today's presentation is an introduction to what is possible. It's an inspiration for what you could be part of, the impact that you can have, and it will be enough information for you to get things moving. It is to make you aware that we will be able to provide you with great materials and support. So there's not a lot of work required on your behalf to get set up and start up. There's already a network of committed and motivated people and committed to seeing God's principles of justice, freedom, and mercy applied. And so today, the call is to come be part of that community. So what is human trafficking? The United Nations defines human trafficking as the recruitment, transportation, transfer, harboring, or receipt of persons by improper means, such as force, abduction, fraud, or coercion, for an improper use, including forced labor or sexual exploitation. The US government defines human trafficking as a use of force, fraud, or coercion to exploit the work and bodies of others. Now, I could spend quite some time today regaling you with emotional stories of the horrors of human trafficking, of dignity and hope lost, families broken, lives and spirits destroyed. Instead, though, I'm going to assume that you're aware of all of that, that you're here because you know that human trafficking is without question and without excuse unacceptable, that we share a common belief that God made every human life valuable and gave no one the right to exploit another human. So rather than use the time tonight to establish that point, I want to talk to you about how you, where you are and with what you have, can start saving lives tomorrow. Whether you're deployed to an overseas mission, a disaster response, or working in a local ER, hospital, or clinic, you can start to use the skills you already have to help the people you already see, to give them information and options that are going to lead them to freedom. So what is the scope of human trafficking? Please understand that setting out to measure human trafficking is like trying to count grains of sand under the sea. It is by design hidden. So numbers are completely rubbery. They are a guide only, increasing almost every day as we understand more about the issue, and completely different depending on what source you trust and what methodology they use. So totally, there are an estimated 40.3 million victims of human trafficking. So in rough terms, pretty much the entire population of Cambodia and Australia put together. That's 2 entire countries. Of this, approximately 64% are trafficked for forced labor, 19% are trafficked for use in the sex industry, and 17% are in state-imposed forced labor. Though it varies from country to country, 29% are male and 71% are female. This is an example of one of those awkward pieces of data. As an example, in Cambodia, this is completely flipped the other way, where 71% approximately are male and 29% are female. 75% are older than 18 and 25% younger. Could we flick to the next slide? That would be great. 64% of these are involved in construction, domestic work, or agriculture. I could go on for hours about data. Lance mentioned that I firmly believe that data-driven programming is a key to success. Here in Cambodia, we have over 90,000 individual survey records from victims of trafficking and potential victims of trafficking that guide our programming and decision-making. So how is this all relevant to you? Well, you can start identifying victims of trafficking tomorrow, pretty much no matter where you are. I remember the good old days when human trafficking, was a problem in Asia, or it was a problem in Russia, or a problem in China. No one in those days ever imagined that it would be a problem in Australia, or the scope that it would be a problem in the US. But today we know that human trafficking is in every place where the heart of man is turned away from God. So everywhere. As an example, the US State Department estimates that only 1% of all victims of trafficking in the US have been identified. In 2017, the Modern Slavery Report estimated that there were 58,000 victims of trafficking living in the US. That same report this year has increased that estimate to 400,000 victims of trafficking. Has human trafficking really increased that much? Yeah, I don't think so. I believe it is more the case that we are becoming more willing and able to identify the victims of trafficking. And my goal here today is to make it obvious to you that you could be one of the people who join this fight. I want to explain something to you today about why medical professionals can be such a key to breaking slavery and setting people free. Why involve medical professionals? I mean, you guys, surely you have enough work to do already. Why are we going to ask you to take on something else? I spent 5 years working in the arena of sex traffic rescue. I was based out of Chiang Rai in northern Thailand. This involved hours of endless desk work, miles of street investigation, days and days of village investigation over hundreds of kilometers of roads, tracks, and goat tracks, the all too occasional rescue, and the long and arduous follow-up and procedure of rehabilitation. And when we were very fortunate, it involved the prosecution of perpetrators. In short, rescue is hard. It is expensive. And it can place you in a high-risk environment for relatively low returns. Human traffickers, quite understandably, like to hide. Around the world, millions of dollars and millions of man-hours are being invested just to get started on an investigation, just to enable us to get a hint of where we might make a start to find someone who might need rescuing. There are rooms full of people trolling the internet, endlessly scrolling through chat rooms, engaging traffickers and exploiters on forums, in the hope of getting a starting point for an intervention. Most times, this effort results in nothing. Most days, you go home hoping that you have better luck tomorrow. As medical professionals, you, however, have these victims of trafficking, these vulnerable and broken souls, walk directly into your office, voluntarily and at no cost to you. A study from Loyola University of Chicago in 2014 found that 88%, that's 88 out of every 100 of victims of trafficking that were rescued, had had direct contact with a healthcare worker while being trafficked. So while we were looking for them and not finding them, they had direct contact with a medical professional. Depending on the study and the country, this figure will range from between 25% to 90%. But be that as it may, while people on my end of the field are out tirelessly looking for victims of trafficking, they are walking into your workplace. They are walking straight into where you work. And unfortunately, too often, walking straight out again. This is why we're here today. Certainly why I'm here today. Because as medical professionals, you have an entirely enviable and, to my knowledge, unequaled opportunity to be a point of contact, a ray of hope, a source of information, a way out, a way through, to be the Samaritan on the roadside. And in this case, the road leads directly through your office. They are coming to you. That's what excites me so much about this. So what am I going to ask of you today? I'm going to ask you to be that open door. I'm going to ask you to sow seeds of hope. I will ask you to show the tangible, real-time love of God. I will ask you to take the time to look, to inquire, and to respond. Or to use the US Department of Health and Human Services terminology, because it's awesome and very clever, I'm going to ask you to soar. I'm going to ask you to stop, to become aware of the nature and scope of human trafficking, which you may already be. I'm going to ask you to observe, to recognize the signs, which you're going to be empowered to do today. To ask, that is, to identify and interact, engage, talk with possible victims of trafficking. And lastly, to respond, that is, take appropriate action. So to stop, I'm going to ask you to invest the time to become aware of the nature and the scope of human trafficking to find out about what is happening in your operating environment. There are no doubt organizations operating around your area who can give you local information. Reach out to them, or reach out to people like us, Samaritans Perth, and we will help you with that. Observe. Now, I know that oftentimes you only have a 15-minute window to see a patient, but even in this small window of time, there's sufficient time to recognize the signs of human trafficking. You are medical professionals. I cannot tell you how excited this makes me. You spend your whole day recognizing symptoms, delicately asking probing personal questions, linking the obvious with the root cause. You are, beyond doubt, the perfect target audience to try and recruit into the identification of victims of trafficking. This is totally your wheelhouse. It is impossible for me to tell you how excited I am that you're here today and that you are bringing your passion and your skills to the table. So this will be simple. You will be quite easily and quickly, you'll be able to incorporate this into your daily life, and it will have a massive impact on the world. Imagine with me just for a second that there are 1,000 doctors who see four people an hour, 8 hours a day. How many people you are able to pre-screen and help? Running the numbers, which is too long and too tedious to do here, just on that basis, we could expect to see 2,000 people a year rescued from trafficking without starting a new organization, without increasing funding, just simply using the passion and the skills which you all bring and already have. So let's look at a scenario, if we could. This is not exactly a real life story, because people's stories are exactly that. They are their stories. They're their own, their stories to tell. It is, though, based on real life. One of the thousands of real life stories played out every day across medical clinics and hospitals the world over, and drawn from experiences that I have been part of. We're going to call this guy Raul. Raul walks into an emergency clinic. I chose Raul as an example because Raul is a Filipino. I know a Raul, and I've asked him if I can use his name. He's not the subject of this case study. But the one thing, for those of us who've traveled the world, we know that one thing you will find wherever you go are Filipinos. They're everywhere, and there's never just one of them. Raul is a middle-aged man. He walked into the reception desk of a hospital or an ER, clutching an obviously injured arm. He's still bleeding and in clear physical distress. He introduces himself, but takes the time to repeatedly glance over his shoulder to a man in the back of the room. No one notices. The desk clerk professionally and politely works through the administration process. Raul does not have any ID with him. He says it must still be at work. He gives his name, but has trouble remembering his address. He is in pain and bleeding, so no one really notices. When asked, Raul says he has no insurance. But this happens, so no one really notices. The nurse takes Raul to do the basic first checkup, blood pressure, etc., makes professional and pleasant small talk. As they leave, the man from the back of the room goes to follow, but is stopped by the desk nurse. Raoul takes one last furtive glance over his shoulder, but no one notices that. "What happened, Raoul?" he is asked. "I had an accident. I was doing roofing work, I slipped and I fell. And on the way down, I cut my arm on some exposed Rio bar." The lady with him is a nurse and she's focused on her job. She does not notice that Raoul just described at least 3 major occupational health and safety violations. It goes unnoticed. She does comment that it seems like dangerous work. Raoul quietly confirms, "Yes, I'm not very good at it. I'm actually a tiler." At this time, another nurse arrives to ask Raoul some more questions, to check his medical history. "Have you ever been sick before?" "No." "Have you ever been to a hospital before?" "No." "Have you ever had an operation before?" "No." Do you have any allergies?" "No." "Have you had a tetanus shot?" "I don't know." For a middle-aged construction worker, this would be an unusual set of conditions, but no one notices. Then the doctor comes in and is polite and professional, courteous. He explains to the man what procedure he is about to perform, that it will involve some local anesthetic, some stitches, and a bandage. Raoul nods and sits quietly, very quietly during the procedure. It is exceptionally unexceptional, except that there is no small talk at all. Raoul seems distant and distracted. He offers no engagement with the staff. He never raises his head and never makes eye contact. But there is bleeding to stop and stitches to put in, so no one really notices. During the procedure, it was necessary to lift up Raoul's shirt, and they see a large collection of scars. But there are other more important things going on, so no one really notices. As soon as the doctor is finished, Raoul stands quickly, collects his things, politely thanks the doctor and the nurse, and turns to leave. The nurse quickly gathers the appropriate medical supplies he will need to tend his wound and passes them to him. No one notices his rush to leave, as there is another person in need of medical care in the bed right next to them. He walks straight to the cashier on the way out and uses the US $1,000 he brought with him in his pocket to settle his bill. A construction worker without ID went to work with $1,000 in his pocket. But the cashier is processing a long line of people and doesn't give it a second thought. No one questions it. Everybody feels good about the work that's been done, knowing that his immediate physical needs are met. Raoul walks out, having received all the care he needs, except that he didn't. Raoul never told anyone that he was hurting all over. He never mentioned that he only eats 1 meal a day. He only has access to 1 liter of water a day, is constantly lightheaded and dizzy, and has had a continuous headache for a month. He didn't mention he has no phone of his own. He's not been able to talk to his family for months and is worried sick about his wife and kids back home. His passport has been taken by his employer and he's not been paid in months. He has a $10,000 debt to his recruitment broker that he is paying off. As he leaves, the man in the back of the room, without any care or conversation or concern, grabs him by the shoulder and walks him out of the room. But no one notices. Raoul is a victim of trafficking. Nobody noticed. His window of hope is over. So what's to be done? The signs of human trafficking are not obvious. They're not like bleeding or vomiting or a fever or a heart attack, though it is equally as dangerous and impacting on a human life. Now, I only have a very, very rudimentary understanding of medical care, but I understand that there are 3 levels of engagement with an illness. And I'm sorry if I'm making a mess of this, but 1, prevent the occurrence. 2, reduce the duration. And 3, stop things getting worse. How can you, as a medical professional, use this same approach to human trafficking? Let me reiterate, this is not a comprehensive training. There are great materials available. They are easy to find, and we will supply you with great materials as part of the process in the near future. On the other hand, it is simple enough that you can start implementing what you learn even today, as soon as we're over. So to recap, the first step, become aware of the nature and scope of human trafficking. The fact that you're here on this Zoom conference means that you're probably aware before we started, and you certainly are now. The second step is to recognize the signs of trafficking. So let's talk about human trafficking. What are the signs of human trafficking? What signs could you as a medical professional detect in the course of a normal daily practice? Let me emphasize again, this is not about adding a function. It's about changing focus. This is not about you need to do more work. It's not about there needs to be more detail in your life. It's about just a shift of focus. Now, I don't know about you, but we all love a checklist. I love a checklist. So, and as with all checklists, there are a range of options from your cut down basic model right up to the deluxe 200-page version. So simplistically, you could start by using a simple 10-point checklist that gives you an indication of whether a person is or is not a victim of trafficking. Let's bring up the checklist and see how many you recognize from Raul. So if we could get a click, that would be great. Thank you. Bruising, scars, burns, and cuts, especially those in non-apparent places. That's Raul. Multiple STDs or pregnancy tests. No, we didn't have that. Fearful, anxious, or depressed. Yes, that was Raul. Cash payments, no insurance. Yes, that was Raul. Malnourished and multiple medical issues. Yes. A third party may speak for the patient or not allow them to speak or watch their every move. Yes. Substance addiction or appearance of withdrawals, not in Raul's case. Lying about the age, not in this scenario. The patient was transient or didn't have an address. So yes, that's that one. A tattoo of a name or a strange symbol, not for Raul on that one. So even on a simple checklist, Raul got 6 out of 10, which is well and truly enough to make you ask a few questions. Let's try a more detailed assessment. And these assessments, these checklists are going to be available. Again, see how many you recognize from Raul's story. General signs of trafficking. Shares a scripted or inconsistent history. That means the story changes. Is unwilling or hesitant to answer questions about injuries or illness. Is accompanied by an individual who does not let the patient speak for themselves refuses to let the patient have privacy, or interprets for them. Evidence of controlling or dominating relationships, demonstrates fearful, withdrawn, or nervous behavior, is resistant to assistance or demonstrates hostile behavior, is unable or unwilling to provide his or her address, is not aware of his or her location, current date or time, not in possession of identification documents, not in control of his or her money, not being paid wages, or in a rush to leave. Specific signs of labor trafficking. Now, I know we've all heard a lot about sex trafficking, but labor trafficking by volume is a much more common scenario. They've been abused at work or threatened, is not allowed to take adequate breaks, not provided with adequate personal protective or hazardous work equipment, was recruited for different work than he or she is doing, is required to live in housing provided by the employer, or has a debt that they cannot pay off. Specific signs of sex trafficking. The patient is underage and involved in the commercial sex industry, has tattoos or other forms of branding, reports an unusually high number of sexual partners, does not have appropriate clothing for the weather or venue, repeatedly treated for sexually transmitted diseases, or uses language common in the sex industry. There are also a lot of general health indicators that point to a person being a victim of trafficking, which we won't go through here, but we can include them in notes we can make available for you. What do you do, though, if you suspect that a person is a victim of trafficking? What do you do if you suspect that the person sitting across from you, in the chair opposite you, that you know is going to be there for another 10 minutes, is a victim of trafficking? And this is where some people start to stumble due to a shortage of skills or courage, but you do this all day, every day. The third step is ask, identify, and interact with the possible victim of trafficking. Very few victims of trafficking are going to walk into your office and just straight on ask for help. Very few will tell you that they're being trafficked. Very few will stop you or even slow you down long enough that you notice the signs that are there for everyone to see. The onus is on us to engage and interact. Now, in engaging, it's important that you use practices like trauma-informed practice and safe spaces, which are two critical trainings that we don't have time to do here. But again, not that difficult. Before even beginning a conversation with a person you suspect may be a victim of trafficking, give thought to the safety of both you and them. And remember, the goal is not immediate rescue. It's not even that they come clean and tell us everything that's happening to them. The goal is to create a safe and comfortable environment where you are able to further identify the indicators of trafficking, to be able to make the effort to show God's love, and to assist the person as much as they are willing and ready to be assisted. Some basic things to remember, which you probably already know. Separate them from supervising or controlling people. Find a place where they can speak openly and privately, perhaps while taking blood tests or scans. Make time to establish rapport. If you're unable to do this due to time pressure, see if there's a social worker or counselor who can engage. Make sure the person is comfortable. See if they need to speak to a person of their own gender, or if an interpreter is required. But make sure you also follow your own hospital or medical clinic's policies and procedures for safety. The fourth and last step is respond. Take appropriate action. This is where we all hope we can get to, where we can be the person that helps someone be free. And I'm not going to lie to you, this can be tricky, but let me remind you again, the goal is not to be the white knight on the horse. Your goal is not to probe and delve and coerce people into admitting or acknowledging that they're a victim of trafficking. The goal is to create that safe, comfortable environment where they will be able to receive God's love, to assist, and so you can assist them as much as they are willing and ready to be assisted. Every situation of human trafficking is 100% completely unique. It is vital when addressing potential victims of trafficking that the center of any action is their care, their well-being, their dignity, and their right to choose. Not all victims of trafficking will be comfortable disclosing their situation, nor will all victims be ready to seek assistance right now. It's hard to understand, I know. Surely they would jump at the opportunity for freedom. But no, that's not always the way it is. People transition from victim to survivor. It is rarely a one-step process. You may have the privilege of being God's representative, the one who helps the person take one of many of those steps to freedom. Or you may have the rare privilege of helping a person take that single step. The truth is that you've only seen this person for a fraction of their life, and you'll only see a fraction of the things influencing their decisions. As a medical professional, though, you are uniquely positioned to provide potential victims of trafficking with a range of information, a range of options, compassion, unconditional love, and where you can, referral to services, sometimes rescue. You may be bound to take action under your jurisdiction's legal system, for example, in the case of minors, where you have a mandatory reporting obligation. So what should you do to prepare locally? You should research a functioning local national hotline. By functioning, I mean one that actually works. It's answered and has trained staff. You should know how to contact your hospital security, know your local law enforcement rapid response number, know available referral options, and ensure that any evidence of physical injury is accurately recorded. So as we finish, let's just consider one more story. As we do, I want you to think back to the indicators of trafficking that you are already starting to recognize, and you'll see how easy this is. You're deployed to a temporary hospital in a disaster area. There's been massive destruction. Hundreds of people are dead or missing. Thousands are injured. There are thousands of people requiring anything from a bandage and a pat on the head to major surgery. The triage area of the hospital is chaos, and you are called on to make the hard call on who does and who does not get access to treatment. Sleep is a luxury and one you can't see happening for some time. In the midst of this, a young girl, her name is Sophia, is rushed in with a massive crush injury from where a wall has collapsed on her small frame. She is in bad shape, but there is no doubt that surgery will be able to save her life and return her to health. Her revealing and sexy clothing seems out of context with everyone else who is coming in from the same area. But you've got no time to wonder about that. She just says she's been at a party when the disaster happened. Though in pain, she is conscious and determined. You remember her as a fighter, but one with a bit of an attitude. She is uncooperative, belligerent, refuses to give you vital contact details or addresses. But there's no time for that. She needs surgery now. Surgery goes well. You see her again in recovery, and that belligerent, combative attitude is still there. It's understandable, though. She's been through a lot. She'll still not give you contact details or a next of kin. But you dig into God's grace and patiently talk her through her injuries Explain she's going to be okay. She's safe here, safe from the danger, but she's going to have to be here for some time. She almost immediately relaxes, becomes instantly more open and cooperative and communicative, but still can't or won't give you contact details. The days go on, her recovery is going well. During the course of her treatment, it's found she has a sexually transmitted disease. When you tell her about this, she's not surprised or upset. It tells you this is not the first time. The STD is treated and healed. It's not given another thought. We're here to love. During this time, you've formed a relationship with her. And apart from the fact that you still don't have any family contact details, things seem normal, or as normal as they can be. During this time, conversation turns to the night of the disaster, and you ask about the party she'd been at. She stops abruptly and questions you. What party? I was just at home. One day later, the local authorities arrive with news that they have traced her uncle, her only remaining family. He has been distraught, thinking she was dead, and has been looking for her everywhere. He will be around later in the afternoon to pick her up. On telling her this good news, she immediately disconnects from you, becomes belligerent and uncooperative again. She seems to withdraw. It catches you by surprise. But the hospital is comfortable and warm with good food and love available 24 hours a day. Why would you want to leave that environment to return to the chaos outside? You need the bed, and she no longer needs a hospital bed, so nothing more is thought of it. 2 weeks later, another man shows up at the hospital, tears streaming down his face, clutching Sapia's picture in his hand, desperately looking for any information, any trace of his beloved child. This is Sapia's real family, her father. She had been missing for weeks before the disaster, snatched from the local market when she'd been out to buy vegetables for the family. You have just accidentally handed her back to her trafficker, the man who stole her, abused her, raped her, and sold her. Is it understandable? Yes. Is it acceptable? No. Do any of us want to live with that regret? Definitely not. Can we avoid it? Absolutely. So following this forum, we will make sure we have available for you the simple 10-point checklist, the extended checklist, basic things to remember, things to prepare, the PowerPoint, the text of the presentation, and links and resources. There are many evils in this world that we can do nothing about, but human trafficking is not one of them. Individual empowerment is within our reach. Community awareness is within our reach. Darkness only exists where there is no light. So with that, we could go to discussion and questions, because that would be the end of my formal presentation. Thank you so much.
All right, Barry, fantastic presentation. I humbly admit I really don't know a lot about human trafficking, but as you and I have been discussing and planning, I plan to learn a lot more about this, just this global problem that I think here at Samaritans Purse and World Medical Mission that we have the capacity to address. So I just want to reach out to our listening audience, just encourage you to reach out to Barry. This is your opportunity to ask him questions. As you all do that, I just want to say what we're really hoping to do as we go forward is really develop a much greater curriculum for the whole medical sector at Samaritan's Purse through World Medical Mission and DART, and just train our healthcare professionals to identify the victims, as Barry has so articulately pointed out today, and then really make available to you all opportunities for referral, so that we really can curtail and mitigate this this massive problem. I can't think of a better way for healthcare professionals to really serve, and I call it holistic healthcare, and I think this is just a massive global issue in healthcare. So I'm excited to see us really become more involved, and just encourage you guys to look for these opportunities as we present them further to you. Barry, so far, I'm amazed we don't have any questions for you yet. You must have done a very thorough job. I think that was pretty evident. I just want to go back to a couple points as we're waiting for perhaps people to pose questions to you. I think, just again, I admit my naivete to this topic. And I think this is something that everybody really, as healthcare professionals based in the United States and domestically, we think this is a problem that's exclusive to Southeast Asia or something like that. But it's a massive problem right here at home. And, I thought about it as we discussed how we can provide resources for our healthcare professionals at Samaritans Purse. I thought this will be great when they go out to volunteer through World Medical Mission or they go out to DART. We can really prepare them to identify victims, but really this is something that we can utilize extensively right here at home too in our own practices or when we go out. So there's just vast opportunity to recognize these victims and provide help for them.
So Lance, I guess if while we're waiting, I just would like to encourage people that one of the really simple things about this is that the message is so simple that it's not like heart surgery or a lot of more technical things where everybody needs to attend a formal training. If you can pick up some training yourself, it's easy to pass on to people around you. And so the multiplying effect of what can be done is massive. Like if you can share with a few other people and they share with other people, before you know it, you've got a massive net of people who are on the lookout. And we've seen that has been able to set entire communities free from the impact of trafficking.
Absolutely. So yeah, Barry, I couldn't agree with you more. And just I appeal to you, our listening audience, just really share this recording with your colleagues, other people in Samaritan's Purse and elsewhere in your church. This is really, as I said over and over, it's a global issue, and I think we can have real impact here. So Barry, Alan Sawyer, a good friend and obstetrician, poses a question. He says, are there a few good questions you could recommend for doctors to ask at-risk patients?
Yes, absolutely. Generally, at-risk patients will exhibit withdrawn behavior. I mean, a lot of times. And so what you want to do is find a question that gives them an opportunity to express why they are being withdrawn. Simple things like, I'm just thinking of a doctor the other day I was talking to who mentioned that one of her patients was being withdrawn and was not well. So she asked her, for example, like, what do you get when you go to the grocery store? And her reply was, my vegetables are brought in for me. My food is brought in for me. So questions that indicate whether the person is free to move by themselves. You can ask simple questions like, how much water do you drink in a day? And they might say, like I only drink 1 or 2. And you can then follow that up with, well, would you be able to drink more water? And then they may be able to reveal to you that they don't have access to water. Or you could ask them, you appear to be working very hard. Your body's been taking some serious knocks here. Do you think you could relax a little bit and give it a rest? Questions that give an indication of their, their environment, where perhaps a victim of labor trafficking might reply, no, I'm not free to rest. So probing questions, I guess, would be my short answer to that one.
Yeah. Thank you, Barry. Yes, and I think sometimes they're actually accompanied by the perpetrator, and those are suggestions you gave are excellent, discrete questions that I think can give you a lot of information without really revealing that you're, obviously that the overarching concern is trafficking. But
Absolutely.
yeah. Barry, another question. John Fisher says, there are screening tools online. Also, CMDA has a number of modules that are being updated. Look at SOAR, SOAR training, and HEAL, HEAL.
Absolutely. There are great materials available. And this is the encouraging part, that there's not a lot of work that needs to be done in developing new materials. Really, all that needs to be done is for you to look at things that are already available and contextualize them into what will work in your scenario and what you're able to do. So totally agree. There are great materials there.
Right. Barry, Skip Roy says, I volunteer in a free clinic where we don't ID a patient's immigration status. What risk do I put a patient in if I suspect that they are a victim of trafficking?
That's a super good question, because always we have to remember that the goal is to respect the person's right to make decisions, which, if you believe that you're going to put a person at risk by identifying them as a victim of trafficking, the goal is to empower them and give them the opportunity to self-identify, maybe through the national hotline or maybe through local referral agencies. There are a number of safe options for people who are not legal migrants to still identify as a victim of trafficking. And it won't immediately result in them being, deported. But yeah, again, that's a resource that is available and we can certainly help you find, for sure. But it's a really good question.
Awesome. Okay. Well, Barry, I think that's really it in terms of our questions. We're going to wrap things up here. Let me just say how much I appreciate your presentation there. I know it's 1 a.m. there. So thank you so much for coming to us from Cambodia. It's amazing that we have this technology that you can do that. And it's obvious, Barry, the passion that you have to address this topic. And again, I hope we've really imparted some of the same out to our listening audience. I just really appeal to you all today that you would get involved. You're going to see more materials available after this recording. Some of the materials that Barry presented today are going to be immediately made available to you in follow-up emails. And also, I just want to remind you that CME credit is available for this recording. The form and instructions are going to be in your email, which we will be following up after this recording. And I just want to take a second and stop and really, again, appeal to you as our listening audience, just with regard to this whole webinar. Please encourage your friends, other people that are in the DART or World Medical Mission, surgical subspecialty teams, all the medical sector here at Samaritans Purse, or your other friends in your church and your hospital, clinics, etc. I think as we respond internationally and utilize medicine for the sake of the gospel, it behooves us to educate ourselves. We know a lot about domestic-based medicine, but there's a lot of topics we don't know about. I don't know a lot about human trafficking. I'm going to find out a lot more. We have a lot of a really rich and robust archives of recordings that have CME attached to it. If you just go to health.samaritanspurse.org, you can watch hundreds of recordings about internationally related medical issues and get CME credit for it. And I just think it really, it should be a real motivation for us as we involve ourselves here at Samaritan's Purse. Our next webinar will be Wednesday, March the 11th. Great speaker, Dr. John Fielder. He is an international expert in HIV management. He is going to be discussing HIV-associated tuberculosis. So please put that on your calendar, tell your friends. And with that, thank you so much for joining us today. God bless.
God bless.